Radiology interprets imaging studies performed on patients, usually ordered by the gastroenterologist or surgeon, and results of the imaging study are reviewed potentially with the gastroenterologist or surgeon, either in a conference setting through the Center for Advanced Digestive Care conference, or over the phone, or in someone's office. And often the results of the imaging study will determine what happens next to the patient. The role of imaging in pancreatitis is to detect it or confirm its presence and assess for its severity. In a general sense, staging means how far advanced the tumor is. When a tumor is found in the pancreas and for example, it's characterized as a malignancy, then it's important for the radiologist to determine if it's potentially resectable. And that's done by assessing involvement of important structures such as blood vessels and even looking for metastatic implants, whether it be in the liver or the coating of the intestines, in which case the patient would be deemed to be unresectable. But if the patient is thought to be resectable based on a CAT scan or MRI, for example, then imaging helps to assess the exact location of the mass, what it's contacting, so that it can act as a roadmap for the surgeon, and the surgeon can then be best prepared prior to the operation. Secretin MRCP is a specific type of MRI. What makes it different is that the patient's vein is injected with a hormone called secretin that results in the pancreas secreting fluid into this pancreatic duct, which then drains into the small intestine. After we inject the hormone, we do this MRCP sequence over the course of 10 minutes. And what normally happens is that the pancreatic duct will distend slightly. And in normal patients, the pancreatic duct is only 2 to 3 millimeters in diameter, so it's pretty small. And detecting subtle abnormalities of it can be somewhat difficult. When administering secretin, the pancreatic duct becomes more distended. We can see subtle narrowings or little stones in that duct. We can even see subtle anomalies of the pancreas, which includes pancreatic divisum, which is an entity where the main fluid of the pancreas gets secreted through a different hole in the small intestine that can be a cause of recurrent pancreatitis. Secretin MRCP is also used sometimes in the acute setting of pancreatitis, looking for a pancreatic duct leak. In essence, Secretin MRCP not only gives us anatomical information of the pancreas, but it also gives us that functional assessment, which is unique.